had an individual who had been told by several previous agencies that she had treatment-resistant depression. When she came in, she was just so hopeless, and like they're recommending electroconvulsive therapy. I'm terrified of that. I do not want to do that. And as I talked to her, I realized we're not dealing with treatment-resistant depression. We're dealing with somebody who has an extensive history of trauma. Kind of led to me recommending particularly dialectical behavior therapy. She left a completely different person. And she was actually like really excited to go tell her boyfriend.
We're basically adding a layer of care that is sort of new. It's a newer thing.
So patients can walk in, they can meet during their medical appointments. It's really very tailored to best fit the patient's need.
Where beforehand it was kind of like, hey, we need to refer to this specialist, or hey, we need to refer to this specialist. Basically, they get a little bit of behavioral health when they show up to the primary care. I did have a client that, I sort of explained the services, and they were like, no thank you, I'm all set. In a few weeks, they had come back and they said, hey, I'd like to talk to you. And they were actually kind of going through a mental health crisis. Basically, I helped process through some of that, gave him a lot of resources, and he was able to get sort of into that crisis stabilization unit. And then afterwards, he came back and was very, very grateful. That just felt really good.
Before Access, before we offered walk-in care, it was a lot of the same thing of people coming to their doctor and I can't get in for weeks and I'm feeling suicidal. We'll see you in a month. Like, that's not mental health.
Before we came on the scene, folks would basically just be given a list of places to call. And then they would call and every place would say, we don't take your insurance, we don't take your insurance, we don't take your insurance. And at that point, the patient just becomes very frustrated, and there's a sense of helplessness and hopelessness.
We've had a father and son team come in battling a traumatic brain injury, very overwhelmed. And his dad had said to us as we were working through services, he was like, I'm just so relieved because we've tried so many things. We've tried reaching out, and then we get here and we have access to all of this stuff. And by the time he left, he had a vision appointment, he had a PCP appointment, and he was gonna work with behavioral health on therapy.
Coming to Cherry, I was sort of inspired sort of by the mission.
We have everything. We have adult medicine, we have pediatric, primary care, we have dental, we have vision, we have a pharmacy.
And then we get a lot of people who come in who are unhoused or, really having a hard time, struggling.
You can come to one place and get it all done and not have to drive around the city for 4 different needs. Like, we want to make sure we're taking care of the whole you.
So we kind of just wrap around somebody.
We get this guy who comes in and he is struggling with addiction and he's just really, really angry. And I was able to get him set up with a doctor, and I was able to get him set up with a dentist, and we helped him get into treatment and get therapy. So he had gotten a housing placement, and he told Callie, he said, when I left here that first day, I had a really hard time even making it to the elevator. And then when I got to the elevator, I broke down crying. I think it's a little bit of like, hey, I do see a light at the end of the tunnel, and people do care. People don't realize we have everything in this one building.
Access is definitely what should be a standard within our community. It's just such a powerful and important service, tool, whatever you want to call it.
I think the immediate access to care helps give people that hope.
For us to be able to tell them, like, no, you can just walk on in, we'll see you that same day and get started on services. I think that's a really new thing for a lot of folks.
So it's that kind of like domino effect of, hey, I'm gonna be seen and people care about me. And I think that helps them get, if you're feeling good mentally, if you're feeling good physically, then that helps you turn your life around.
It does sometimes feel like we're changing a life in just one session.
I think everyone needs an access center.
Yes, I agree.